Question 301. During initial assessment of a patient post-endoscopy, the nurse notes absent bowel sounds, tachycardia, and abdominal distension. The nurse would anticipate A. Ischemic bowel, B. Peritonitis, C. Hypovolemic shock, D. Perforated bowel. Question 301 Answer: D. Perforated bowel. Question 301 Explanation: invasive diagnostic testing can cause perforated bowel. Ischemic bowel, choice A, is usually not related. Peritonitis, choice B, can be a complication after initial perforation. Hypovolemic shock, choice C, can occur if peritonitis is allowed to continue. Question 302. Which of the following tests can be useful as a diagnostic and therapeutic tool in the biliary system? A. Ultrasonography, B. MRI, C. Endoscopic retrograde cholangiopancreatography, ERCP, D. Computed tomography scan, CORT scan. Question 302 Answer: C. Endoscopic retrograde cholangiopancreatography, ERCP. Question 302 Explanation: ERCP permits direct visualization of the pancreatic and common bile ducts. Its therapeutic value is in retrieving gallstones from the distal and common bile ducts and dilating strictures. Ultrasonography, option A, aids in the diagnosis of cholecystitis, gallstones, pancreatitis, and metastatic disease. It also identifies edema, inflammation, and fatty or fibrotic infiltrates or calcifications. MRI, option B, detects hepatic neoplasms, cysts, abscesses, and hematomas. A CORT scan, option D, can be done with or without a contrast medium. It can detect tumors, cysts, pseudocysts, abscesses, hematomas, and obstructions of the liver, biliary tract and pancreas. Question 303. To inhibit pancreatic secretions, which pharmacologic agent would you anticipate administering to a patient with acute pancreatitis? A. Nitroglycerin, B. Somatostatin, C. Pancrelpase, D. Pepsid. Question 303 Answer: B. Somatostatin. Question 303 Explanation: Somatostatin, a treatment for acute pancreatitis, inhibits the release of pancreatic enzymes. Nitroglycerin, option A, is a vasodilator and does not affect pancreatic secretions. Pancrelpase, option C, is an enzyme that aids in the digestion and absorption of fats and proteins. Pepsid is an H2 blocker and is used to decrease gastric motility. Question 304. Your patient's ABG reveal an acidic pH, an acidic CO2 and a normal bicarbonate level. Which of the following indicates this acid-base disturbance? A. Respiratory acidosis, B. Respiratory alkalosis, C. Metabolic acidosis, D. Metabolic alkalosis. Question 304 Answer: A respiratory acidosis. Question 304 Explanation: A pH of 7.35 indicates acidosis, as does an acidic CO2 and bicarbonate. Question 305. A clinical manifestation of acute pancreatitis is epigastric pain. Your nursing intervention to facilitate relief of pain would place the patient in A. Knee chest position, B. Semi-Fowler's position, C. Recumbent position, D. Low Fowler's position. Question 305 Answer: A knee chest position. Question 305 Explanation: Flexion of the trunk lessens the pain and decreases restlessness. Other positions do not decrease the pain. Question 306. What assessment finding of a patient with acute pancreatitis would indicate a bluish discoloration around the umbilicus? A. Gray Turner's sign, B. Homan's sign, C. Rovsing's sign, D. Cullen's sign. Question 306 Answer: D. Cullen's sign. Question 306 Explanation: Cullen's sign is associated with pancreatitis when a hemorrhage is suspected. Gray Turner's sign is a chemosis in the flank area suggesting retroperitoneal bleed. Hohmann's sign is calf pain elicited by the dorsiflexion of the foot and suggests deep vein thrombosis. Rovsing's sign is associated with appendicitis when pain is felt with pressure at McBurney's point. Question 307. A patient with severe cirrhosis of the liver develops hepatorenal syndrome. Which of the following nursing assessment data would support this? A. Oliguria and azotemia. B. Metabolic alkalosis. C. Decreased urinary concentration. D. Weight gain of less than 1 pound per week. Question 307. Answer: D. Weight gain of less than 1 pound per week. Question 307. Explanation: Hepatorenal syndrome is a functional disorder resulting from a redistribution of renal blood flow. Oliguria and azotemia occur abruptly as a result of this complication. For option B, excess organic acids are not being excreted by the damaged kidneys, resulting in an elevated concentration of hydrogen ions. Decreased pH occurs, causing metabolic acidosis. For option C, concentration of the urine is increased with decreased renal function. For option D, with renal insufficiency, significant weight gain is expected due to fluid retention. Question 308. Which phase of hepatitis would the nurse incur strict precautionary measures at? A. Icteric. B. Non-icteric. C. Post-icteric. D. Pre-icteric. Question 308. Answer: D. Pre-icteric. Question 308. Explanation: Pre-icteric is the infective phase and precautionary measures should be strictly enforced. However, most patients are not always diagnosed during this phase. For option A and C, precautionary measures should already be in place. For option B, there is no non-icteric phase. Question 309. You are caring for Rona, a 35-year-old female in a hepatic coma. Which evaluation criteria would be the most appropriate? A. The patient demonstrates an increase in level of consciousness. B. The patient exhibits improved skin integrity. C. The patient experiences no evident signs of bleeding. D. The patient verbalized decreased episodes of pain. Question 309. Answer: A. The patient demonstrates an increase in level of consciousness. Question 309. Explanation: Increased level of consciousness indicates resolving of a comatose state. Other options are important evaluation but do not evaluate a patient in a hepatic coma who is responding to external stimuli. Question 310. What is the primary nursing diagnosis for a 4th to 10th day postoperative liver transplant patient? A. Excess fluid volume. B. Risk for rejection. C. Impaired skin integrity. D. Decreased cardiac output. Question 310. Answer: B. Risk for rejection. Question 310. Explanation: Risk for rejection is always a possibility, especially during the 4th to 10th day postoperatively.